Hey Al, Rochelle here. Just wanted to take a little bit of time to talk to you about role boundaries. Um, One of the things that can easily happen, especially after we're here for so long, is that all of the providers and the patients and the PSRs and everybody that we work with become very, very familiar with us as individuals and also as a company. And in doing that, it can be really easy to start feeling like a partner in the work that everybody does. And while that's true, there still need to be very clear guidelines. An example is when I go to my doctor's appointments, I'll see nurses kind of come in and out the front end, but the nurse is never there to check me in or to receive the incoming call or anything like that. And sometimes the front end is just swamped. In the same token, when I go back into my room, I never have a PSR taking my blood pressure or my weight or asking me the triaging questions about medications. It doesn't happen. That's for the nurse to do. And then again, when the provider comes in, they have their role. They're not taking my blood pressure or my weight or triaging my medications, or not even triaging, but verifying my list of medications. They're there to treat me and to do the job that they're there for. So in all of that, I don't think that any of them see other people busy and think, I'm just going to let them be. I don't really care. It's not my job. That's not the intent at all. The intent is that when people stick to their position and their role and stay within that boundary, even in really busy times, that's what makes things run as efficiently and effectively as possible. For everybody that works there within each group, they know what to do each and every day. They're best suited to handle the incoming situations at that particular progression in a customer experience. So that is where we need to stay as well. And for me as a customer, as a patient, I know the predictability of how they're going to answer the phones, what they're going to say to me, what they're going to ask for, the way I have to tell them the information. Every single time I call, I know exactly how it's going to go. So I know after time that, hey, this is Rochelle. How are you? This is what I need. My date of birth is this. My last name is that. Because I know that no matter how friendly I am with the people who answer the phone, they're still going to need that same information in the same order each and every time. So there's friendly, hi, how are you? How are the kiddos? Or whatever the relationship may be. But when it comes to the process itself, it's very consistent and it's very predictable. So for me, when I go, I know what's going to happen each and every time. If I saw the nurse out front talking to somebody and answering the phone, and then she had to rush back by me and she had to do all of these different things, it would make it less predictable and there would be chaos. And so where we fit into that is, as interpreters, we have very clear guidelines and boundaries. And our role within the dance that is healthcare is to help people communicate with their patients. And so it's our responsibility to be as predictable as they are in what patients can expect, what providers can expect, so that the efficiency in the dance that they've created, we're seamlessly integrating, but without taking on anybody else's job responsibilities. Some people might say, well, what about customer service, right? Somebody, they need help, or I want to do this. Here's the guideline. If it's something that you would do as a normal human being, if you were walking into the clinic and you saw somebody who was lost, or you saw an old person or a wounded person or anybody, and you'd open the door for them, or you'd give direction, or you'd smile and say, how are you? All of those things you would do as an individual, that's fantastic. We should be doing that every day. And when we're out and we're represented and everybody's pleasant and friendly and helpful and within those boundaries, it's a wonderful experience and the customers are very, very happy. But what happens if you have one person doing it one way and another person doing it another way and crossing, kind of operating within a gray area, if not crossing the line, all with the intent of being very helpful? It actually it destroys the constructs that make us work as well as we do alongside of our customers. it makes some customers appreciate and say, well, this person does all of this for me. And another of your colleagues might come in staying more specifically within their boundaries as interpreters. It doesn't mean that that person doesn't care about the same level of customer service, that they don't care about the patients, or that they don't care about the providers, but they're staying within a certain scope and another person's in a different scope. And so when we have that, it can actually cause people within our team to feel like they're not appreciated, or that people think that they're doing it wrong, and they're not. And so it's very consistent to stay within the guidelines and the boundaries of what the job of, or the role of the interpreter is. We all do it differently, and yet it's the same. My personality is very, very different from Erin's personality, and so that doesn't mean we're not both good interpreters. It just means that we go about it in our own personal way. So very important to respect the job and the role of other people and their function within the healthcare organization. Very important to stay within our guidelines and boundaries as interpreters, and how we integrate into that organization and that system. And that's the best way that we can join the dance and meet the needs of everybody that we encounter. So thanks for your time, guys.